Most doctors don't have a clue about what you can do for tinnitus. I was working at an audiology residency program in San Francisco at UCSF Hospital, which is a leading medical center in California. And I was working in the tinnitus treatment department as an audiologist. On my schedule one day, I saw that my patient was from Lake Tahoe, California. And when I asked the patient when they arrived, "Is it true that you came here from Lake Tahoe?" And she said, "Yes." Then I realized that this patient just drove 4 hours from the mountains in California and the Sierra Nevadas, beautiful Lake Tahoe, down to San Francisco, California. A 4-hour drive to get help with tinnitus. Well, I asked the patient, "Did you see other doctors? Tell me about your history." She said, "Yes, I went to an ENT clinic, I saw an ENT doctor, and I saw an audiologist as well. The ENT doctor said there wasn't anything wrong with my ears and said that I had tinnitus, didn't really say much else. And the audiologist did the hearing test and said I had a mild hearing loss in the high pitch range and that I could try hearing aids if I wanted to." So the patient was looking for answers of what's the cause of her tinnitus, what can I do about it, and provide a roadmap for me. She was thinking and hoping, I need a roadmap, I need solutions, I need things I can do. And she went to 2 doctors in a reputable area in a wonderful town in California and was told that there's not much she can do. Obviously, it's frustrating and creates this sense of helplessness and despair. Fortunately, this patient actually went on the internet and started to look for hospitals or clinics or specialists who could help with her tinnitus. She found San Francisco as an option. So she went to the leading center for tinnitus there and she was put on my schedule to see me. I was the audiology resident in that program after attending graduate school to become a doctor of audiology in San Francisco. And that patient was on my schedule. So when I realized this, I had this moment where I felt, oh my goodness, I knew the demand for tinnitus services was so strong. I knew that people were suffering. I knew that local doctors provided care for tinnitus, but I never realized how much of a gap there was between the average experience of a tinnitus doctor or a specialist who can help you with tinnitus versus a true expert.
This is a short interruption from today's video to announce the Tinnitus Quiz. Are you frustrated by your tinnitus? Does it affect your ability to concentrate or fall asleep? If you're ready to find lasting relief from tinnitus, visit tinnitusquiz.com to get personalized solutions and treatment techniques to help you manage your symptoms today.
This patient went to an ENT doctor in a reputable area and wasn't given an option. So most doctors just don't have a clue about what you can do for tinnitus. And I wish this wasn't the case. Part of my mission here on my YouTube channel at Treble Health with our telehealth practice is to change this narrative, because how different of an experience would that have been for this patient if she was told, hey, there's no medication, there's no surgery that's relevant to your particular case. So there's nothing medically wrong that we need to address here in my ENT clinic. That's a good thing. Now let's focus on solutions and treatments and therapies for tinnitus, because you can manage this and get your tinnitus to a better place where you can find relief, where you can live a full and productive life. That is the message. That's a 15-second message. That's what the doctor needs to say. The patient then settles down. They calm themselves down. They say, okay, so what's next, doc? This is how I want this to be. Then the doctor would say, let me refer you to a specialist who can help you with your tinnitus. And then that doctor should have someone to send them to. Our team specializes in tinnitus. This is a big part of our mission, is to be there on the front line so that the ENT doctor does not make tinnitus worse. It's okay that there's a gap of knowledge. We don't need everyone to be a tinnitus expert. It's just unreasonable to think that they will. But changing the narrative just slightly from there's nothing you can do to I can't do anything for you, let me refer you or direct you to doctors that can. That makes a world of difference to a patient, because who knows how many weeks or months this patient was in Lake Tahoe just suffering and feeling hopeless with her tinnitus. She had to find the information online, consult Dr. Google, travel 4 hours to a different clinic. This was the pivotal moment in my story where it really planted the seed. It really hit me hard that I needed to do something different for these patients who are struggling. Eventually, after years of contemplation and getting the courage and the energy to start something, I started with a YouTube channel, and that's what you're watching here on my YouTube channel. I started with this YouTube channel to give high quality information to people with tinnitus. And eventually after that, started a telehealth practice, a one-on-one consultation where it was just me meeting with some of you, having Zoom conversations, providing guidance and support on treatments and solutions for tinnitus. Okay, so why am I telling you this story? Because some of you may just want to be curious about, hey, what's the origin story of your YouTube channel? What's the origin story of Treble Health, your telehealth company, your telehealth practice? It was this patient who drove 4 hours. But the other piece of this that I wanted to share is that it's okay that there's this knowledge gap between doctors of tinnitus, but it's not okay that a patient has to find the information on their own and then have to go through that process of, quality control and vetting and understand, do herbal supplements work for tinnitus? Does acupuncture work for tinnitus? Does tinnitus retraining therapy work for tinnitus? Well, I know that out of those three, tinnitus retraining therapy is the one that the patient should try, not acupuncture or herbal supplements right out of the gate. Sure, those can help for some people, and we can discuss that later, but focusing on the fundamental methods, the foundational approach, how that makes the world of difference. And we need a majority of patients struggling with tinnitus to understand these fundamental concepts. Well, if other doctors aren't teaching it, then who will? Fortunately, I've found that with technology, with YouTube, with videos, with content creation, we can give all the information away for free. The only thing left, the only missing piece here that I can't create on YouTube for you is a personalized coaching and personalized approach for understanding the detailed history of what's going on in your case, and then recommending a solution or a comprehensive treatment that touches all of the points of why you're struggling. Additionally, medical devices that you would use for your tinnitus, we can't do that through a video or through an app. That also has to come from a specialist like myself, where we would send the medical devices for tinnitus, like tinnitus maskers, sound machines, hearing aids, etc. We would send those to your house via telehealth, and that's how you would get that care. So part of my mission here is to provide as much free information as possible here on YouTube so that you can self-serve, self-select. What do you have questions about? What do you need to know? What is holding you back with your tinnitus? And you can get that information here in video form. But then when you need expert one-on-one coaching, which is highly recommended, when you need to take your tinnitus relief to the next step, when you're looking for that solution, having medical devices for tinnitus that you can get in a convenient and affordable telehealth manner through Treble Health, that is the mission. That's why we do what we do. And that makes me so proud, because there is a huge need for help with tinnitus. There's many millions of people who are suffering from this, and most of them have not been offered or even explained the best practice, medically recommended, science-backed treatment approach. And that wakes me up in the morning. That gets me fired up to make these videos. It also makes me a bit sad, but I'm not going to dwell in the negative. I'm just going to use it as fuel to serve more people and have a bigger impact. So if you've enjoyed this story, give it a thumbs up. My name is Ben Thompson, audiologist with Treble Health. This is an explanation of my origin story and how a patient who drove 4 hours away ended up really inspiring me to leave the clinic in San Francisco, to start the YouTube channel, to start the online telehealth practice. And in 2022, for example, we saw 3,000 individuals. We've helped 3,000 individuals over telehealth help find relief from tinnitus. And we see hundreds of new patients every month. So I'm really proud of the impact, and I'm really proud of our team. That's been another amazing part of this, is hiring some of the nation's best tinnitus specialists. And we're able to see patients nationwide and provide care. I'm really proud of this. And I thank you for watching, and thank you for supporting my mission here. Bye-bye.